Hello everyone. Today we are going to see a nursing OIT nursing letter that is the patient's name is Beryl Casey, and this is 72-year-old woman. Now she underwent osteotomy hip replacement, or we call it left hemiarthroplasty. Let's go into detail what exactly this thing is. Actually, we do have this particular writing task. You are going to write a discharge letter. So whenever you are writing a discharge letter, you need to include some relevant information, because it is not transferring from one word to another. So you have to execute some thing. You need to report some important information to the person you are handing over the patient to. Here we are handing over your patient to the nursing unit manager, and she is the nursing unit manager at a rehab center at Waterford. So this is the thing here. Actually, we are discharging the patient to a rehabilitation center at Waterford, and the letter you are writing to is to nursing unit manager. So this gives you an idea what exactly the things should be included in this particular task. So you need to select most relevant, semi-relevant, and irrelevant. So we do have 3 types of data. So you need to identify all these 3 categories, and then we need to do appropriate tasks. Right now, we move back and see what exactly the case is, what we can understand from these things. Now you can see the patient name here, Mrs. Beryl Casey, and she's 72-year-old. And now she's discharged from hospital to the rehab center. She's widowed, 2 children, lives locally, and granddaughter's interstate. Son lives locally and daughter interstate. So that's, I think, it's not. No, she lives alone. No. A very important data is here. So we can say that that is the medication, which is a long-term medication. And why they have given the dosage, it might have some, we might have some relevance. So we can see some relevance there in the letter. Now, naturally, admission date. I'm writing, I'm just marking relevant and semi-relevant data. So when we go with the admission date, so it's 4 February 2014 at midnight. So the 12 hours, in the sense it's midnight. So if you write 13 hours, it is 1 p.m. Okay, so no, 12 hours is not midnight. Actually 12 hours is noon. Okay, So 12 hours, 13 hours. So when we go ahead with the 23 hours, it is 11 p.m. and 00 is midnight. That's it. I'm mistaken. Sorry. And now we have X-ray. And X-ray revealed that this is the diagnosis: fractured left neck of femur. And what we have diagnosed, this is a fracture here. So we are going to go with the surgical intervention here under general anesthesia, and that is left hemiarthroplasty. So we call it Austin Moore hip replacement. So right now we are going ahead with the left hemiarthroplasty because it's in the left leg of femur. The fracture is there. So if I want to write Austin Moore hip replacement, then I have to say on the left side. So I have to minimize the number of words here. As we can see, the case note is a little bit lengthy than usual. Now, when we have the post-operative data, so let's see that what it is exactly it is post-operative data. Excuse me. Now we have post-operatively, we have given 3 units packed cell, and this is given intraoperative and post-operative. So it was given during the surgery and after the surgery. Intravenous therapy for 34 hours, 36 hours. Now she is taking oral fluids. IV antibiotics, Sabazal, and that course is completed. Hypotensive. Now reviewed by the doctor, and the medication it reduced from 10 mg to 5 mg. For the pain management, fentanyl was given initially. Now they are giving Panadol. And next is the dressing. Now, what type of dressing? We need to give a regular dressing. Dressing change should be there at periodic intervals. You can say the drain tubes removed, then alternate staples removed, day 5, and dressing changed. So these things are either relevant or semi-relevant. Now I am moving ahead with the activities of daily living. That is what's there happened from the day of the surgery. The day of the surgery was on 4th of February 2014. I think the year is correct. Yes, it is 24, and I think so. So day 1, day 2. So day 2 means it is 6 February 37. 5 means age. Okay, 2, 3, 4. 5 means it is 9, and day 6 is 10 February. So this is an important date here because you are preparing for discharge and writing the letter on this particular date. So you are writing this letter on 10 February as the days are calculated. So on 6th of February, she started sitting out of bed. On 7th of February, she started mobilizing with pickup frame with 2-person assist. But in 9th of February, she started mobilizing short distances. And we can say anti-embolic stockings. Now we have activities of daily living with the full assistance. Now we have marked these things there. We have cleared the doubts regarding the dates there. So on which day we are writing, when they are going to discharge. So that's on 11th February, the discharge date. 12th February. This is on 14th February. So on 14th February, remaining staple removal will be done, and then the wound can exposed. That's it. So the thing is analyzed. Now we can go ahead with the letter. Can mark that is 10 February, that is on day 6, we are writing the letter. The nursing unit manager, rehab center, Warford. Dear manager, you better write, you better write, dear sir or madam. So you can write dear manager too. So you can write dear sir or madam. You can write nursing unit manager too. Now, reference Mrs. Beryl Casey, aged 72. I am writing this letter to introduce Mrs. Beryl Casey, who is recovering after a hemiarthroplasty, into your care for further management and rehabilitation care. So you are writing to the manager, so that's why you have written into your care for further management, because you manages the thing, and rehabilitate care. So you are in charge of the rehabilitation center. So if you are writing the discharge letter to this nursing unit manager, you have to write the purpose as for the management and rehabilitative care. Clear. The patient name, condition, recovering after hemiarthroplasty. So this patient is being introduced to you. Okay, she requires further management and rehabilitative care. Miss Casey was admitted to our hospital. Okay, I don't need this comma there. Miss Casey was admitted to our hospital following a fall 6 days ago. So that is something which we need to see here. 6 days ago. So the time frame, so you can connect. You are writing on this particular date, and you are just connecting it. We are just connecting it chronologically. So there is a connection between the sentences, as well as there is a connection between the time frames. So instead of writing that particular date, that's on 4th February 24, I've written 6 days ago to connect these things, because you are writing in this date, today's date. 6 days ago, she was admitted to the hospital. So this is the thing. So we have 2 types of connection. One is the connection between the sentences and paragraphs, the linkers, all these things. The second is the sequential things, that is the chronological connections. Okay, so better go ahead with that the next day, the next week, after a month. These things are very important here to connect these things, to make it a relationship tighter. Now, radiological examination, the case note you have seen, it was X-ray. So we have not copied that thing. So we went with the radiological examination, confirmed fracture on the left neck of femur. So this is the diagnosis for which she underwent the aforementioned surgery the same day. So the same day means it was on 4th. Okay, again, it is connected. Now I can say that this two things gives you an idea what happened. Now, the purpose of this paragraph is what happened. Now, after that, what things we gave. So it is grouped in another paragraph. During and after the procedure, Mrs. Casey was administered with 3 units packed cells. So we can say it here, 3 units packed cells, intraoperative and postoperative. That's the thing. From here, I need to cross-check these things. During and after the procedure, Ms. Casey was administered with 3 units packed cells. She was supported with IV fluids, antibiotic, the name is given, and IV analgesics, fentanyl. So that's the thing. We have these things here. I can show you IV antibiotics, this thing, and analgesia, fentanyl. So analgesia, it was IV, and now it is oral analgesia right now. So we have IV therapy here, 3 unit pack cell here, these things. So we have a lot of things here, but I need to make it concise that we have given these things. I need to give that much explanation there. What you have given, I have given cefzine. What you have given, fentanyl. So this is a painkiller I have given initially. This is the antibiotic I have given initially. Later on, this thing, the course completed, this thing, we switch to Panadol. Sorry. She was supported with IV fluids, IV antibiotic, and analgesic. Okay. Now, I have one problem here. I don't have particular route here where how the fentanyl how it was given. So it is better now to use this IV analgesic. So I am not sure IV analgesic. So I need to reconsider this area. We'll come back and see what just happens here. IV analgesic. So it was not given clearly whether it was given intravenously or intramuscularly. Okay, so I can the one solution I can do here right now is that I just go with that IV analgesics. So and injection fentanyl for pain. That's it. So it can be given IM, it can be given IV. She was supported with. Now I can better use the vocabulary provided with. Her course of antibiotics, you can see her course of antibiotics was completed. It means this thing is over, and currently she is taking Panadol orally for pain management. Now she was taking fentanyl, now she is taking Panadol for orally for pain management. One more thing, medication is important. One more. Because she was taking Ramipril, the dosage of her antihypertensive. So here it is spelling antihypertensive was halved from 10 mg due to a, I can say, sharp fall in BP. So I cannot just halve the hypertensive from 10 to 5 mg for a simple fall. So if it is a noticeable fall, then only I can reduce the thing by half. So I have used it, a sharp fall in the blood pressure. Now the next thing, her post-operative prognosis was good. Yes. So we have given these blood transfusion, IV fluids, antibiotics, fentanyl, then Panadol, then Ramipril was half. So these are the medication segment is clear here from this part to this part. These supports are here. Now let's see this particular area, her post-operative prognosis. This is another area. It is combined. So we have not separated that into, some of the students, they separate it into two paragraphs. Right now we have not separated. So we group this paragraph like what all we have done after the surgery. So what is the reason for the surgery? After the surgery, what the things we have done? This is what we have categorized in paragraph, this paragraph. So some candidates, they just split this paragraph because they don't want to write a bigger paragraph. The reason behind why we have classified this as paragraph is that what happened, what was the reason for the surgery, and after the surgery, what are the medications you have given, what are the further care you have given, the care you have given in the hospital till the discharge. So all these things, including medication and nursing care, are concluded in this particular paragraph. So her post-operative prognosis was good, as evident by, now I can say as evident by or evidenced by. It is evidenced by. Successful drain tube removal in 48 hours. So you can say in 2 days. The second day you can see the drain tubes are removed there. And staple removal. I have to make a correction. Alternate staple. Oh, the staples, all the staples were not removal. Alternate staples removal. Staples removal. Plural. No. On the 5th day after the surgery. So let's see in detail what exactly that thing is. So this is what they are telling. So the drain tubes are removed 48 hours. And now you can say in day 5, yeah, day 5, you can say alternate staples removed. These are the things. Now, so currently she is being mobilizing short distances with assistance, but she needs full assistance in carrying out her routines. She is also on anti-embolic stockings, which need to be there for 2 weeks. Agreed. But now an important thing is missing here in this particular paragraph, the care you have given. An important thing is missing, and that is dressing. In the case note, we can see that wound management. So you said that the drain removal was done, drain tubes was removal, then alternate staples were removal. So dressing was also done after the medication. So you have set segment number 1, medications, very clearly all the medications, because you are going to discharge, you have to say that there is some relation for hemoglobin. So you have to say that the pack cell is given. Yes, you need to constantly monitor the HB level. You need to monitor the BP. So ramipril, it is mentioned there. Now, I have to say something about dressing. It is missing here. That is the only thing. So where we have to include this dressing after the procedure, you can say pain management, dosage of post-operative progress was good. Successful drain removal, the 5th day. Currently, she is being. So right now, wound can remain exposed afterwards. So you can include that dressing either in this paragraph or in the next paragraph. So you can say, if you, as Mrs. Casey is being transferred to you tomorrow, that is the day they are telling it tomorrow. So today is not the day that discharge is done tomorrow. Strict medication compliance, I can add it here. Strict medication compliance, periodic or regular dressing, and so I think wound dressing, I can say wound dressing. Strict medication compliance, wound dressing, and regular monitor of her BP are recommended to continue. So medication compliance is strict. We were doing that. Wound dressing, we were doing that. Regular monitoring of BP, we were doing that. Her hemoglobin level needs to be assessed. Okay, I can say reassessed. It means we said repeat. So reassessed once we have assessed, or twice we have assessed in the hospital. Now it needs to be reassessed. And on 14 February, I told that is on day 10. Her remaining staples can be removed, leaving the wound exposed. So the relevant data we have written here. One more data is missing there. You can say that assess for rehab therapy inpatient or on return home. So if you are good at the language, you can include that thing. So that's also duty of the rehabilitation center. The manager should assess, because it is the duty of the manager to assess the rehab therapy. So you are giving a therapy and you need to assess the progress of the therapy and decide whether the patient is to be continued in her rehabilitation center further as an inpatient, or can be discharged back home. That is, you need to assess the progress of the rehabilitation therapy and decide whether the patient can remain in the rehabilitation unit or can be discharged back home. So this is what the thing. So we need this is an important data. Okay, so we have assessed that thing too. So it's a big thing. So it's not a silly thing. So we have a lot of word count here. So we try to include this thing too in this particular letter. And within this particular framework, this is a basic framework we have. Okay, and you use yours faithfully, because you have not written the name of the it's dear salutation, dear manager. We don't have a name there, so it's your faithfully registered nurse. Now this is a basic framework. We have to make the word count reduce further and upgrade this thing to we need some sort of standardization. So just please consider this as a basic format. These things, it's better if you have a basic framework like this, and these things are ideal data which we can include. And I told that one more data is vital, that is the rehabilitation status, whether to discharge back home or to stay in the rehabilitation center. That also can be included in this particular case now. I hope all of you must have understood this particular thing. Thank you, one and all.